All right. Good afternoon, everybody, and welcome. It's right at 4:30, so I'm going to go ahead and kick us off here, and we'll get started. You could call this week spring break, right? I know a lot of folks are out, and it's good to be with you again after the long holiday weekend last weekend. So we're going to pick back up where things kind of left off. There are some good signs this week. There are some concerns ongoing, as always. And we still got a lot of work ahead of us. And I think what you'll see from Dr. Owen are some interesting stats today, not only on the US, but sort of what we're seeing throughout the world and how we compare. Now, the one thing that Dr. Owen has cautioned us about in the past are the number of strains that are in this country that we don't even know about. And one of them has popped up this week. I'm going to defer all that to Dr. Owen. I know he's going to weigh in on that topic with more detail. So questions, get them in the chat. We may open it up to more of just a conversational format with the numbers that we have on now, but I want to let Dr. Owen get through everything that he has to cover here first. And outside the webinar, we've got a little bit of a redesign on our Tryon Direct website. If you need us, go there and ask us a question. Let's get started. Dr. Owen?
Hello, I hope everybody had a good Easter holiday or whatever holiday you celebrate, and we'll get to it. Let's go ahead with the first slide. All right. Obviously on the far left, this is what we've been used to seeing, but please notice on the far left that within that, we're starting to see a flattening, if not a slight uptick in cases. Now, remember all the different phases we've seen previously. And when we tend to get these are when we're more open, not following social distancing, when we're more out and about. And these have tended to occur around vacation times. If you remember, there's the peak around July the 4th, there's the Thanksgiving holiday, there's the Christmas and New Year's holiday, and now we're dealing with the Easter holiday, spring break, opening up a lot of venues now, the various states and in North Carolina. And put on top of that, a third wave should be starting right about now, which we've already seen happen in Europe. So remember how it's been several months since we've talked about this. We normally see a significant rise in cases first, usually about 7 to 10 days after the holiday is over. So we would anticipate by Monday of next week that we start seeing a rise in cases. And remember then that hospitalizations start to increase about a week after that, and deaths 1 to 2 weeks after that. So it's kind of a phased approach. First the cases, then we get the hospitalizations, and then followed by the death reports. You can see in the bottom right that the hospitalizations have also plateaued, and there's a just slight hint of increase that is following what we're seeing in number of cases. This is across the whole US. Next slide. We know about the 3 vaccines, we know about their effectiveness level, and we know that effectiveness level is not the only appropriate measure, as it measures only cases that are completely prevented. 95% for Moderna and Pfizer, and 72 to 75% for J&J. But what's the most important is the ability to prevent serious infections of COVID-19 and the ability to cause hospitalizations from those infections and deaths. And they were all 100% effective with the strains that had been evaluated. Remember, of course, that the Johnson & Johnson vaccine was tested against UK strains and South African strains because those countries were participating in these vaccine trials at the time that they had these mutations already occurring. The Moderna and Pfizer vaccines were not. However, we've seen that when later tested and found to have some of these infections after having Pfizer and Moderna with some of these UK and South African strains, that they were not deadly to the people who contracted them. So we anticipate then that all three vaccines have similar efficacy and prevention against all of the strains we've talked about. Let's go ahead and go to the next slide. And I'm going to get back to the mutations here in just a minute. If you look here, we can see that North Carolina is sort of in the middle of the road. About 33% of the people in the top left have been vaccinated across the United States with one shot, and 19% are fully vaccinated. And you might say, why aren't they half of each other and one half of the other? That's because some of the people are getting Johnson & Johnson. They only get one shot, and so then they're fully vaccinated. That's part of it. North Carolina is running about the same. The percentages as of 2 days ago were about 31% and 18% in North Carolina. So I think it's running neck and neck with the national average. All right, next slide. Okay, so the last time we really spoke significantly was in late March. And if you see on the left-hand side that we were starting to see a plateau in the number of vaccinations given per day. And I told you then that we were going to have an issue that if we didn't increase our distribution capability for those who can actually put the vaccine in somebody's arm, we didn't have enough people doing that, that once we opened up that bottleneck of supply, we were going to have a problem. And the next bottleneck was going to be the distribution sites. Well, guess what's happening? We saw that as they started to open up some of the distribution sites, that in late March and early April, that we see an increase in the total number of vaccines given per day, reaching 3 million, okay? Sometimes a little bit more on certain days, up to 4. But then we're starting to drop off again. Some of that is related to the actual Easter vacation and people taking vacation afterwards and so forth. So we're going to see that lull. We've seen this happen in the cases reported too, with each of the vacation times. But we have some good news on the right, that we're starting to see a higher rate of general vaccinations, so that we believe that by about June 16th, 70% of the population in the US will have had one vaccine. All right, and remember, one vaccine probably gives you about 85% prevention or degree of immunity. So once we increase that supply of vaccine and we increase the distribution sites to deliver the vaccine, I think we'll see that increase even more exponentially. And we want to see this 70% mark occur before the summertime hits. It's going to be harder to get people in to vaccinate. We have more of a captive audience now. And I think it'll be an easier way on both the economy and the population as a whole if we can get everybody herd immunity of at least one vaccine by the end of May. We should also start to see this occur even better once we have the EUA approval for 12 to 15 age group, 12 through 15 age group for the Pfizer vaccine. We anticipate that is coming soon. The data is already out that is very effective. We just need authorization now. Next slide. All right, so let's look at the left-hand graph. And you can see that in March, we started seeing France increase, Brazil increase. The United States hadn't increased yet. It's starting to in late March. And then we also see Canada start to increase, pardon me. And these are all signs of a third wave. It's also a sign of other issues at the same time. We've got more liberal social distancing issues going on. We're opening up more. And, you know, this is a balancing act between the economies and health. And, you know, the death rates and so forth like that. So we are seeing significant third wave in Europe, and we're starting to see that actually curtail now a little bit. And we're just seeing the beginnings of this in the US, but hopefully we'll get people vaccinated fast enough that will blunt this upslope significantly. That's what we hope to see. Next slide. All right, so this is really important, and this is really critical. Let's go to the bottom first. Will you be able to get a COVID-19 vaccine? You know, back in January, people weren't really sure. Through March, they're getting a lot more information. And then at the bottom of it, we see, when will you be able to get a COVID-19 vaccine? Well, in the state of North Carolina, we know it's everybody. So the whole bottom of this doesn't really matter anymore, because everybody can get a vaccine. However, we don't have enough supply sites, and we don't have enough distribution from that standpoint. We don't have enough of the vaccine. We still have a little bit of a bottleneck from the vaccine. We anticipate in the next 3 weeks that we're going to see a tremendous amount more vaccine coming in. It also wasn't helped much either when 15 million doses were, I wouldn't say destroyed, but inappropriately packaged and so forth in Baltimore with the Janssen vaccine. So that would have been 15 million more people that could have already been vaccinated. Huge hit to what we had wanted to see. Look at the top graph here. You can see that as of December, we had only 34% of the people willing to get the vaccine as soon as possible. 39% were going to wait and see. 9 and 15% were only if required, only if somebody makes me, and then definitely not. Things have changed a lot. End of March, we see 62% of the people have either already gotten the vaccine or are willing to get the vaccine as soon as possible. Only 17% now wait and see. And 4% of that group of only if required, definitely not, have changed their mind. And they've moved either into wait and see or what have you, but they've moved out of that lower percentage. So if you look at the end of March, 17% are going to wait and see. Another 20% are only if required and definitely not. That's a whole lot better. We're now dealing with 37% of the population not getting it yet. I think we're going to see that improve even significantly more, a lot more. We've seen a tremendous change. 22% of the population has moved to the left since December. And I think we'll see another 10 to 20% of the population additionally move to the left eventually over the next couple of months. Next slide. All right, here we go, the W mutation. So I'm going to read from a few notes because I can't remember it all either. And you can go straight to the bottom line that there's no definite evidence that this double variant is more virulent, causing more severe disease. So virulence just means how much it injures, but it is considered to be more contagious. It is considered to make people sicker, but it's not more deadly. And we've not seen any evidence that the current vaccines out or your previous immunity from a COVID-19 infection would not be effective at defeating this particular viral strain. So the W mutation means that it has two different mutations. One of the sites is similar to the South African, Brazil, and New York City strain. That's the E484Q mutation site. It was first brought to the attention of the world on March 24th out of Mumbai, India, the province where Mumbai, India is. 15 to 20% of the cases reported there were of that particular strain. Stanford in with San Francisco patient confirmed a case the very next day on 3/25. It is more infectious, it is more transmissible, but the vaccines are felt to still be effective. But I'm not going to stop there. We're going to also talk about the Indonesian strain called the EEK, EEK strain. EEK. It's called the E484K strain. It's also more virulent, and it's a similar mutation to the South African and the Brazil strains. Again, felt to be able to be defeated by the vaccines that are out, or your own previous infection from COVID-19. Remember, this is really, really critical. The antibodies you make to kill this virus, COVID-19, the antibodies you made from a previous COVID-19 infection or from the current vaccines of Moderna, Pfizer, or Johnson & Johnson are all the same antibody being made by the human beings who receive these, because it's all the same spike protein that's being delivered to your immune system. Therefore, if we get a significant mutation on the spike protein of future mutated strains of COVID-19, if that spike protein is mutated enough that the antibodies from those previous vaccines don't bind to that spike protein to destroy it, then we essentially are starting all over again. That's the issue. Now, there are a lot of pundits out there right now of the community around the world, including the People's Vaccine Alliance with 50 organizations, 77 experts over 28 countries. 1/3 of them believe that in less than 9 months will render vaccines currently given ineffective. 2/3 believe it'll be in less than 12 months. 1/8 believes it won't be any problem. And a lot of this has to do with the fact that about 10% of the majority of the poor countries will be vaccinated in 1 year. So what we're seeing here in North America, and especially in the United States, is that we have great access to vaccine, but the rest of the world does not. And a lot of the poorer countries are not anticipated to have more than 10% of their population vaccinated by the end of the year. Therefore, they will be generating more mutations. And the United States and other very wealthy countries have been stockpiling vaccine. And we knew this was a problem even 8 months ago. Our problem is going to be, can we isolate and quarantine enough the countries that don't have access to vaccine until they can get vaccine? That's going to be a huge issue. So we are not out of the woods once we get everybody vaccinated, because a lot of the world does not have the same level of access to the vaccines that we and the Western European countries have access to. Next slide. All right, we've seen this before. What can you do and what can't you do? Well, if your next door neighbor, everybody's fully vaccinated there, and you want to go over there and sit and have a glass of wine with somebody next door who's fully vaccinated and their whole family is, and they're practicing appropriate behavior, then sure, you can have no mask and no distancing. If you want to go to grandma's house that grandma hasn't seen anybody in 6 months and hasn't been vaccinated yet, but you have, you can go see grandma, and no mask, no distancing. However, if you go to the next door neighbor's house and they've got a bunch of the teenagers there and kids that have come home from college and they haven't been vaccinated and they're all going out to bars and so forth, well, guess what? You really are going to need to socially distance and wear a mask when you're around those folks. Why? Because you've been vaccinated? Because you still can contract the virus and you don't know what strain they have. Remember, with the J&J and presumably also with the Moderna and the Pfizer vaccines, they're only about 75% effective at preventing those more virulent strains, okay? So 25% of the people can still catch those and still spread it, but they don't have serious infections, right? It's the previous strains, the ones we've dealt with mostly here in the United States that came from Europe initially, that they're 95% effective against, okay? And clearly, obviously, if somebody's infected, you want to stay away from them. They need to be quarantining and so forth. So look on the left. Here are the types of activities. The no-nos, it's easier to understand what you can't do than what you can do and have to remember the what you can do list. You know, visiting indoors without a mask, people who had increased risk for severe illness, not a good idea. Attending medium or large gatherings, also not a good idea. I know that we're all interested in going to large group events and basketball games and high school football games that will come up and soccer games, baseball over the summer and so forth. Still not a good idea. You don't know who's practicing what type of habits there with those individuals. And it's a true melting pot. It's like the hurricane party with every type of alcohol that we all saw in college and so forth. You never know what's in there or who spiked it with what. Same issue. Got to be really careful in those situations. And we understand why we want to open up things from an economic standpoint. We're all tired of being cooped up. But we've got a really short duration before we can open things up and feel a lot safer. So try and stay out of large public gatherings. Next slide. So remember this fun slide? We had to dissect who were frontline workers, under what circumstances, and when the moon was full on a Saturday, only on even years and so forth. You know, all that's over. Everyone gets vaccinated. Everyone's considered at the same level. And that's here in North Carolina, but that's not true around the rest of the nation. A lot of them are still practicing different levels of groups because each state's allowed to do it different. But here in North Carolina, everyone can get vaccinated now, and there's no significant priority. I would still say if there are healthcare workers that have not been vaccinated, I would put them very close to the top because they're in the risk of getting it or catching it from people who are already sick in hospitals and such. So, next slide. All right. So I wanted to make sure that we updated things on the different mutations that you may or may not have heard about. The double mutant strain, the EEK strain out of Indonesia, and we do believe that all of them are still going to be defeated by the vaccines, that these vaccines are still effective against them. And when we say effective, that means 100%, excuse me, completely not catching the virus, but more importantly, how effective is it at preventing serious illness? And we still believe they're 100% capable of preventing serious illness that can lead to hospitalizations and death. So,
Dr. Owen,
questions?
No chat questions yet. We'll pause. We'll give you a break for just a second. And when we come back, so I'm going to watch the chat for a minute. You talked about the J&J vaccine and the shortage because of the contamination. What are we seeing as far as supply of Moderna and Pfizer? So I'll throw that out. And anybody with a question, put it in the chat. We can answer it, or we can wrap up early, whatever.
Yeah, Moderna and Pfizer vaccine, we're scheduled to get more and more of it. You know, right now we are probably running anywhere between 800 and 1,500 vaccines a week that we have access to, that we're delivering. I anticipate that to be 3 to 10x that within the next 6 weeks. It'll probably be gradual to get there. We're already preparing to have vaccine clinics instead of Wednesday through Saturday. I anticipate we'll be on both days of the weekends. I anticipate that it'll be much longer clinics in 5 to 6 hours It would not at all surprise me in the next month or two if we don't have some places going 24/7, even in our group and other places, to be able to get this vaccine out as fast as possible. We don't want any of this vaccine spoiling, no matter what.
Dr. Owen, we do have two questions.
Sure.
These are good ones. What's the latest research on whether or not someone who is vaccinated can get other non-vax people sick? So I'll let you take that one.
So I answered that a little bit already. If you've been vaccinated, remember you still run a 5% risk of catching the regular COVID-19 that we saw coming out of Europe, 8 to 10, 12 months ago. Because the Moderna and Pfizer vaccines are 95% effective, so 5% can still become infected with COVID-19. And it would also depend on which strain, because remember, those two were not challenged against or tested against the UK and South African strain. So when we say COVID-19, we can't just lump them all in one. There's the initial European strain, there's the UK strain, South African, Brazil, double mutation, all of those. Everything that was not the initial strain from Europe has significant more likelihood of still getting infected with one of those strains, but you would be able to defeat it without serious illness. So let's take J&J. Let's assume all of them work about the same way that J&J does to these mutated strains, 75% effectiveness rate. That means 25% of the time you can still catch COVID-19. If you can catch it, you can transmit it, okay? We don't know all of the transmission rates because we would believe that it would be less because the viral load in your nasopharynx, back of your throat and so forth would be likely less because you're constantly beating it down with your antibodies you're making. But it's not zero. So that's one of the reasons that we don't want to open things up so quickly once people get vaccinated. They all think that they're, got a force field around them now. That's not true. And if you can catch it, you can spread it.
This one we probably should have hit on earlier. Updates on children's vaccines, so children under 18.
Okay, we do know that age 12 to 15 in Pfizer, remember Pfizer was tested for 16 and above and Moderna 18 and above. So now Pfizer's tested 12, 13, 14, and 15-year-olds, good, similar efficacy as they saw above age 16 and above, but we haven't seen it be EUA approved yet for that, but we anticipate it ASAP. We've not seen that from Moderna.
Okay, very good. And we got one last question. I'll take this one, and then Dr. Owen, if you want to throw in any final comments, you can. So can employers get their employees vaccinated? So as of April 7, it's open to anybody. So no longer do we have to do this. Are you an essential business or are you not? What you need to do is come to us, come to me, come to any of my team. Most of us are on this call.
Right.
And let us know you'd like to do that. We put in the request to the state on your behalf, and you can literally specify which vaccine you'd like. Doesn't guarantee it, but we are able to get that specific. And then if we are granted the vaccine, we're able to administer it for you, whether on location for you or whether you come to us, and we'd be happy to help you with that.
I'm going to add to that, Patrick, and say, if every employer around the United States obviously realizes that taking the J&J vaccine gets them a single time of the vaccine and makes it so much easier on their employees and themselves as an employer, well, guess what? Everybody, every other employer in the nation knows that too. And you're going to be competing more with a smaller supply of Johnson & Johnson, with everybody wanting the same thing. And you might do better to ask for Pfizer or Moderna. Consider that.
Great point.
Granted, it's 3 weeks later, you got to do it again, but you're more likely to have the ability to get that vaccine than to be granted the J&J one. Some will get it, but a good number won't.
I think that's it for questions. Dr. Owen, any parting thoughts?
Yeah, everybody still be careful. Watch out for this third wave for all the different reasons, all the different things that are superimposed that increase our risk, and stay out of the general public right now. We don't have enough people vaccinated yet. We barely have a third of the population vaccinated once. And the last thing we need to do is let our guard down and drive up the viral load in the community again, and drive more of these mutations. The last thing we can afford to have is a mutation that renders these vaccines and our previous immunity ineffective. And the way to have that happen is getting out in the public too quickly.
Very good. And with that, we will close. Hope you can join us again next week. We'll see you then. Have a great rest of your day.
All right, take care, everyone.